Hi, my name's Tom. I'm a student recently graduated in occupational therapy from UWE Glenside, and during my placements I got to work with a lot of people who've been affected by stroke, and these are some of the things that you'll want to know before going out on placement or doing a research project.
Stroke usually happens when there's a clot or a bleed affecting a vessel that is supplying blood to a part of the brain. Because different area of the brain can be affected, that means that people can present with various symptoms. The brain is a very complex organ. The effect of the stroke can vary from people can have very mild symptoms to severe disability. And the other thing about stroke is that it's something that happens suddenly. It doesn't announce itself. Most people are not aware that they're going to have a stroke. And the other misconception is that stroke only affects old people. I've looked after patients ranging from the age of 16 all the way to the age of 102. And also because of impact of stroke is different depending on the individual. Everyone is unique. The patient journey is unique to them. Everyone have a different story to tell.
I was in Ibiza on holiday, and then I was holding my daughter on my hip, and I said to my mum, "Hold her a minute, because something's happening." And I went over on the bed, and just like that, I'd had a stroke. I went into hospital in Ibiza. For 3 days I was unconscious, and then I came around, and I lost all of the right side, and I couldn't speak at all.
We'd been out to dinner. We were both very busy. He was 64, he was coming up for retirement, and we were at the local pub, and we'd had the main course. We were waiting for the dessert to arrive, and he said he didn't feel very well, and could we hurry it up and go home? So I said yes, that's fine. But then the dessert arrived, and he decided to actually quite wanted to eat the dessert. That's fine, but it's a bit odd because he could only see half the plate. So, and then when they came to take for us to pay, he couldn't remember where his credit card was, and when he found it, he couldn't remember the PIN code, and he was getting increasingly distressed by this. When we got outside, he was walking like he was drunk, but he'd only had 1 glass of wine with the meal, which is a bit odd. And I got him home, and it really wasn't clear at that point what was happening with him. So he didn't have any of the fast symptoms. His face was fine. He could raise his arms. He could speak fine. He could answer questions. He was making sense. But he was in a lot of pain, and his blood pressure was through the roof. And in the morning, I phoned the hospital, and it took A&E all day to diagnose him as having had a stroke, and he was admitted.
So when I went out to meet people who'd been affected by stroke, I expected to see some of the more classic conditions associated with stroke, like muscle weakness. But what I didn't expect was just the variety of issues that people can face. So physical ones, often people have a lot of fatigue, and that can affect them quite badly. Emotional issues like emotional volatility is really common, and so people can suddenly start crying unexpectedly, or other emotions as well. And cognitive ones that are like quite subtle and you don't realize at first, and people can take more time to process. And also quite often people will want to tell you the story of when they actually experienced the stroke initially, and that can be quite an intense experience that I didn't really feel like I was ready for. but I just sort of learned to listen and let people say what they need to say, rather than just coming in with your own agenda and the information that you need to get.
I came into hospital 3 days a week to carry on with the physiotherapy and the occupational therapy and speech therapy. And that took me up until June time. And then I was retired off from work due to ill health. And then I just got on with living my life. And I got a splint on my right leg for foot drop, which I will have forever. I can't use my right arm. I can use it from the shoulder to carry bundles of washing, or things like that. And my voice has come back to this. I cannot. I can converse with you one-to-one, pretty all right, But whenever I am placed in a situation of strangers or people who don't know me, I guess a bit hesitant, And I can't, I can say the words and have a conversation, but I can't tell you what the words mean. And I can chair a meeting, but I can't remember what went on.
If you look at him and in a casual conversation, you wouldn't actually know. So physically, he's made a really good recovery. Unfortunately, the stroke was fairly significant. It's left him with significant cognitive difficulties. So there's certain things that he really struggles with. So complex planning and decision making. There's lots of things he thinks he ought to be able to do, and he really can't do them. So there's quite a lot of enthusiasm for certain things, and he can't follow through with it. In social situations, he gets tired very easily, too much stimulation, and his brain can't cope with that. He can't be distracted. He can only do things one at a time. So he needs environment to be simple and quiet, and to know and to be well rehearsed with things, and that gives him a fighting chance to be able to do what he needs to do. So I'm a bit of a spare brain. That's what I am, because his memory is so problematic. Sometimes it's okay, and he can remember some things of what he needs to do. When he's stressed, his memory gets worse, and so he'll need me to prompt him, to remind him. So it's the structuring and the scaffolding and the supporting and the prompting him to remind him of, we've done this before, can you remember what we did before, to try and enable him and to try and keep him as independent as possible.
Aphasia, or a form of aphasia, can be very common after a stroke. And I think mainly because most people, they're very dependent on the left side of the brain, where you have all the communication center. So a form of aphasia can affect the actual content of the speech, in that people can be talking, but the words are jumbled, or they don't have the meaning they're supposed to have. The other form of aphasia is where or patient can speak, however, they find it difficult to understand what is being said to them. In terms of speech problems, some of this can be very, very subtle. And in some people, it can be also be very disabling. So it varies from individual to individual. A lot of time, the stroke itself, it hasn't actually affected people's intelligence. They're still the same person. So it's very, very important that when you're communicating with individuals affected with with stroke that is affecting their communication, that you are patient and that you listen and you don't try to fill in words for them, or you don't try to speak to them in a manner that might indicate that they don't have the same intelligence as you. That can be very insulting to the patient. And the most important thing is patience.
So Jen, could you tell me how your aphasia affects you?
It affects me because I speak more slowly now, and I can't quite find out the words. If it's similar to another word, I say that word to convey what I'm trying to say.
Okay, all right. So it's a lot about identifying.
Yeah.
All right.
Yeah.
Okay. And do you find people treat you differently when you're talking to them for that?
It depends on the person that I'm speaking to. Some people talk loudly and a bit patronising, you know, and won't let me finish what I'm trying to say.
You must be quite frustrating.
Yeah.
And how do you think is a better way that people can interact with you?
Then try and give me time, you know, to process, you know, what I'm thinking as to what I'm going to apply.
Great.
Yeah.
And asking you as well, maybe?
Yeah.
Okay.
Yeah. That is better for the person who I'm speaking to ask me questions, because I can't always think of the words I want to say.
Okay. And so how about your husband? How does aphasia affect him?
He struggles to find words for things. And at times it does feel like he's got a really bad artificial intelligence in his head. Right. So when he's really tired and really run down or stressed or dehydrated, then you can ask him a question and you will get an answer, and it doesn't bear any resemblance to the question you've just been asked, because his brain confabulates. It's like it knows, it's got all of these words in his head and he knows he should know the answer, and he can't say I don't know.
Yeah.
So he'll just generate something.
Right, okay.
And he also struggles to know the order in which to do things. So if you ask him to do something and then start a conversation about something else, he won't know what to pay attention to. So he'll come to a grinding halt.
Okay.
Because
it's got to be one thing at a time. Sort of thing.
Really has got to be one thing at a time.
And so what sort of things do you do then to sort of make conversations go better? And
part of it's giving him the time. For him, it can be very frustrating. It's one of those things you never know. He actually talks about it being, having a conversation is like skating on thin ice. You actually have no idea at what point your brain is suddenly going to give out on you and you're going to disappear into the water.
Right, yeah.
And not know how to call for help or something. That's just he says he finds it with things that really matter to him. Like if we're seeing a solicitor or a healthcare professional, he really worries that it's going to happen then, and that's why he needs me with me, for the reassurance that there is someone there who can, that's what I'm there for, to make him feel comfortable. And there's someone there who kind of does understand.
Okay.
I think that's a very important point, you know, because depending on where I'm going and what I'm doing, if I think I'm going to the doctors or somewhere else, I take one of my children with me to recognise all that the doctor says to me, you know, and appreciate what I can understand. Yeah.
My role as a stroke consultant often involves dealing with people at the very acute stage of stroke. If you can think of stroke, the analogy I often give to my patient is that with a stroke, it's more of a marathon rather than a sprint. I'm that person that is there at the beginning of the marathon that try to fix everything at the beginning. But really, in a marathon, you need friends to run with you. So you have your occupational therapist, your physiotherapist, you have the nurses. They are the ones that run with the patient throughout this marathon. And the impact of what they do, it's 90% of the story of getting recovery from the stroke. And it does impact greatly on what happens after the stroke in terms of people being able to fit back into their normal daily activities after the stroke. So I would say rehabilitation plays a massive part in terms of stroke recovery. And what our therapists do is crucial.
The one thing I would say about aphasia is take your time, because I can't talk fast, and I need time to think.
You can't tell by looking at someone what kind of cognitive difficulties they've got.
I would say if you are calm, and don't rush me.
Please be interested and be compassionate and friendly.
And expect the unexpected. When you're speaking to people who've been affected by stroke, you might be surprised by some of the things you're told, but just remember you're still just speaking to a person and you can just carry on with the conversation. And it's okay to sort of stay curious.
If a family member is present, it's because the person with the stroke needs them to be. So work together with them. They're there to help you, to make your life easier.
Some people with aphasia have nothing else wrong with them. So they might be able to speak a couple of words, leaving gaps for the words that they cannot say, but they might gesture to you, or be talking to them in such ways that they can answer in a variety of ways.
Just learnt that it's important to just listen and let them say what they need to say, rather than just going in with your own agenda and sort of expecting answers out of people, sort of make it more of a conversation.